Thank you everyone for joining our webinar today. This webinar is hosted by the Gateway to Global Aging Data. I'm Tristan Phillips, and my co-presenter, Ginny Wilkins, is also presenting today. I'm going to start first and then she'll present. I think that the webinar should run around 45 or 15 minutes, and we'll have time for questions at the end of it. And if you do have questions throughout it, you can ask them in the question and answer panel, or you could ask them through the chat. I think you can also kind of raise your hand, and we can unmute you if you prefer to ask them out loud. So today's webinar is an introduction to KLOSA, the sister study of the HRS for South Korea. So our hope for this webinar is that we can give you familiarity with the KLOSA, which you might not have already, and give you perhaps some background about the study in particular and how it might be different from other HRS family studies that you're familiar with, and then let you know about some of the gateway tools and products that we offer around KLOSA that could get you started on your research. And Ginny will be doing some examples of analysis using KLOSA data. So I think that should be really interesting, especially for someone who's thinking about using KLOSA or maybe has just started. So a little bit of background about KLOSA. So it's the Korean longitudinal study of aging. It's a nationally representative sample of the South Korean population aged 45 and older, living in private households in South Korea. So the sample does not include people who, for instance, might already be living in an institution, something like a retirement home or a long-term care facility. The initial sample for KLOSA was recruited in 2006 using a multi-stage stratified probability sampling of households, and it covers all geographic regions of South Korea except for Jeju Island. They also did a refreshment sample at wave 5, and that was in 2014. That included 920 individuals who were born between 1962 and 1963. So it's people who were slightly younger than their original cohort. And both samples are followed up with every 2 years. KLOSA was designed to facilitate the measurement of the social, economic, psychological, and demographic status and health conditions of middle and old age people, as well as the development of effective social and economic policies. One of the things KLOSA is particularly concerned about is people's transition out of the labor force, which is why KLOSA started KLOSA's initial sample includes people aged 45 or older instead of 50, as is done in some of the other HRS family of studies. And the study protocols and survey instruments for KLOSA are highly comparable to the HRS, the United States, and the Survey of Health, Aging, and Europe and Retirement, or SHARE. KLOSA's sample included all age-eligible residents of the household, but did not include younger spouses. So for instance, if someone who was age eligible was interviewed, but they had a spouse who was younger than 45, for instance, that spouse wouldn't be interviewed. And that's a little bit different than the other studies. And one other thing that's different than the other studies is the KLOSA sample does not update to include new household members who might be age eligible, or new spouses who are age eligible, or spouses who at the baseline sample weren't age eligible but become age eligible over time. So new people are basically not added to a household inside of KLOSA. And KLOSA does not follow respondents into institutions. So if someone moves to a long-term care facility, they're kind of lost to follow up inside of KLOSA. So those are all some differences that you might want to be aware of when using KLOSA in conjunction with other HRS family of studies. So in addition to the core interview, KLOSA has also collected a grip strength assessment at each wave, exit surveys on deceased study participants starting at wave 2. They've done that every wave. And they also conducted a job history assessment between waves 1 and wave 2. And that's kind of like a life history approach, just looking at people's job history throughout their entire lifespan. If you'd like more information about KLOSA, they have an entry in the Encyclopedia of Gerontology and Population Aging. It's like a cohort profile. It's under the name of Korean Longitudinal Study of Aging. So a little bit more information about their collection period. So you can see there's currently been 7 waves of KLOSA that have data available for researchers to use. They're very consistent with their timing. So as I mentioned, every 2 years. And you can see in this response by wave graph towards the bottom of the slide that they also have a very good follow-up rate, particularly after wave 2. They're really able to continue to follow people. And you can see that additional sample that was added at wave 5. If you're a little unfamiliar with the HRS family of studies, so the KLOSA sister studies around the world include 45 countries. This is a list that is continually growing. So there's a lot of comparable information collected in different countries. And a lot of these studies are considered sister studies because they have similar characteristics to KLOSA. So they are all population representative of older adults. They're longitudinal, so they follow the same person over time. They're multidisciplinarian, so they're not just an econ or a health survey. They try to combine lots of different parts of, capture lots of different parts of people's experiences. They have coordinated survey instruments, as I mentioned with KLOSA. They have enhanced economic data, integrated biomarkers, as KLOSA has the grip strength assessment, and the data is publicly available for researchers to use without any fee anywhere in the world. You can see on the right here some of the other studies. So the HRS in the United States started in 1992, followed by Mexico, England, and then the first wave of SHARE. And then we had a study in Japan called JSTAR, and then KLOSA was the next study. One of the things that we produce for KLOSA are harmonized data. So harmonized data are created to provide research-ready variables which are comparable between sister studies. So variables are defined as similarly as possible across all waves and studies. Each data set combines all available waves from each study, and each individual is one record, so they're called a FAT file. All variables use intuitive variable naming convention as much as is possible. So for example, a variable like R1 BMI is the respondent's BMI value as measured at wave 1. So that's the 1. Study-specific variable names are also used to indicate significant inter-study differences. So for example, in the harmonized KLOSA, there's a variable called R1 LBRF underscore K. And that's the respondent's labor force status at wave 1. And that underscore K indicates that there's something specific about this version of the variable. And that's because KLOSA has a different response scale. They use different categorizations for labor force status than the other studies. So that just lets you know that although a similar concept is captured, so KLOSA certainly captures the labor force status, it doesn't have the same categories as all of the other studies. And these differences exist in all the studies, and I don't think they're necessarily, they're both a benefit and something to be aware of. The harmonized datasets also include spouse versions of most variables. So for instance, a variable named S2 work is whether the respondent's spouse is currently working at wave 2. And variables have been built to account for any survey skip pattern. Currently, we just released, as of yesterday, version D of the Harmonized KLOSA, and it incorporates data from waves 1 through 7 of KLOSA into a single longitudinal data file. So you can see here, it includes, for each wave, it includes at least 2 files that go in from each wave, and we combine them all. So one of the benefits of using the harmonized data is that instead of dealing with 16 different files to look at a person over for person or people who have been inside of the KLOSA sample for all 7 waves, you can use one file which has all of this information already combined. So it saves you a lot of time merging. The harmonized KLOSA, though, does not include all of the survey that's inside of KLOSA, but instead the harmonized datasets focus on survey measures which are most often used or requested by researchers and which are most comparable between waves of KLOSA and between KLOSA and its sister studies. Currently, the Harmonized KLOSA version D has 15 sections. You can see them listed here. Some of the newer sections that we've added include the physical measures, so the grip strength, we have that included in there, assistance in caregiving stress, end-of-life planning, and psychosocial. We also produce a Harmonized KLOSA end-of-life data set. So it's another Harmonized KLOSA data set that we produce, and the end-of-life data set focuses on those exit surveys that are done at KLOSA with deceased respondents. So if someone dies who's part of the KLOSA sample, they try to find a next of kin or a spouse or a caregiver to provide the KLOSA survey team with information about what that person's end of life was like. And we've combined those together in a similar fashion to the Harmonized KLOSA into the Harmonized KLOSA end of life. And we also take some variables from the Harmonized KLOSA. Currently, version A of the Harmonized KLOSA EOL is available, and it was released as of yesterday. And the Harmonized KLOSA, Harmonized KLOSA end of life, like the other Harmonized KLOSA data set, doesn't include all of the exit survey, but focuses on survey measures that are most often used by researchers and most comparable between waves of KLOSA and KLOSA and its sister studies. Currently, there's 9 sections in version A of the Harmonized KLOSA EOL. And you can see that these sections kind of mirror a lot of the same sections that are in the Harmonized KLOSA dataset itself. So a lot of them are questions about what was the situation and status of the individual between the last time they were interviewed and death, and then some questions particularly around the death itself. So for instance, what was the cause of death? How long, where did they die? How has the estate been doled out? Questions like that. Here's an example of what harmonization means between studies. If you recall, one of the things I mentioned is also that harmonized variables account for survey skip pattern. So we can see a couple of things happening here. So on the left, towards the bottom, we have the Harmonized KLOSA Wave 1, and this is the survey skip pattern inside of Harmonized KLOSA. So respondents are asked, have you ever smoked more than 5 packs of cigarettes? Yes or no. In the data, those are coded as 1 and 5. And if the person answers yes, they're then asked, do you smoke cigarettes now? So let's say that we want to make a harmonized variable, which we have done. So, and we call this variable R1 smoke ev. So whether the respondent has ever smoked as of wave 1. Harmonized variables are always going to have the same value code. So a no will always be a 0, a yes will always be a 1. So in this case, the transformation is quite simple. We're just going to recode those 5s to 0s. But we want to make sure it's comparable between all of the harmonized data sets. So if you look on the right, we have ELSI, which is the Brazilian sister study to KLOSA. And you can see this is how they ask about smoking. So first they ask, do you currently smoke? 1, yes, daily. 2, yes, less than daily. Or 3, no. And if you answer no, then you're asked, have you smoked in the past? And you can answer 1, daily. 2, yes, then daily. Or 3, never smoked. So we have to account for this survey skip pattern to be able to make a variable that's comparable to the variable we made in the Harmonized KLOSA. So we know that if someone smokes currently, then we know they have smoked, right? If they have ever smoked. So then those people who have 1s and 2s for the first LC question get coded as a 1 in our harmonized variable. And for that second question, people who don't currently smoke, if they said that they've ever smoked, whether daily or less than daily, it would be, we think, comparable to people who said that they had never smoked more than 5 packs of cigarettes inside of KLOSA, or that they had. And then 3 of no, never smoked is comparable to people who have never smoked less than 5 cigarettes inside of KLOSA. So that can give you some ideas of the advantages of using a harmonized variable. So we know that the value codes are going to be comparable between different harmonized data sets, and the survey skip pattern has also been accounted for. One of the things we provide with all harmonized data sets is detailed code books. So this is true for the Harmonized KLOSA and the Harmonized KLOSA end of life. So these code books introduce the harmonization project and the study itself. They overview the survey timing, survey design, and sampling framework, some of the things that we've already gone over in this webinar. We discuss weighting, how you might weight your analysis, and imputation, so whether values have been imputed. We detail specifics of the harmonization process, and we divide variables into sections based on the research domain. So we saw those 15 sections for the Harmonized KLOSA before, and the 9 sections for the Harmonized KLOSA EOL. Inside of the Harmonized Codebook, we summarize each set of variables. This is looking at those smoke ebb variables. So you can see that we've made one for each wave. And we've also made a spouse version of each variable. Another thing you can see is that we have assigned special missing values. And so a special missing value is a way to indicate missingness with some more information. And they're available as part of SAS, Stata, and SPSS. So you can see there's someone at wave 1 who answered they don't know to that. So we let to whether they ever smoke. So we include that here. We also detail the variable creation and any assumptions made in that creation. And we highlight any differences between waves of that study and any differences between this variable and the HRS version of the harmonized variable. We kind of use the HRS as our basis for comparison between all of the different studies. So while we have just some basic information about how constructed, we say that there's no significant cross-wave differences in KLOSA in this question. But one thing that we do note is in the differences with the RAND HRS, harmonized HRS, is that in the HRS, whether the respondent has ever smoked or not is determined by the following question: have you ever smoked cigarettes? However, in KLOSA, if you remember, whether the respondent has ever smoked or not is determined by the following question: have you ever smoked more than 5 packs of cigarettes, which would be 100 cigarettes. So that depending on what you're researching, that difference might be important to you. So these kind of detailed notes, they take time for us to write and for our team to come up with, but they can really provide invaluable information about the comparability between studies. The last thing we do in the Harmonized Codebooks is we list all the variables from the originating data set that were used in the creation of that variable. So you can see here those questions listed in KLOSA. And that's helpful if you want to go back to the study and look at the questionnaire or the study code books and see exactly what variables we used and perhaps why. Both the Harmonized KLOSA and Harmonized KLOSA EOL datasets have to be created using Stata creation code, which can be downloaded from the gateway, along with the Harmonized Codebooks. So there is not anywhere where you can go and download a Stata or SAS or SPS version of the Harmonized KLOSA. So you go to the gateway and you can download Stata creation code. So it does require that you have Stata. And this Stata code has to be run on the current version of the KLOSA data files, which can be downloaded from the Korean Employment Information Service, who provides the KLOSA data, or KEIS. And a little later, Jenny is going to give you some more information about how you do this. I think that it does sound complicated, but we've tried to make this process as kind of seamless as possible. So it only requires a little bit of work on your end, though it does require that you have access to Stata at least once. There's a number of other resources that I'll just mention briefly here on the gateway around KLOSA. So those include a study overview, survey metadata, concordance tables, graphs and tables, so you can graph KLOSA data, and a publications catalog. I'm going to switch over to the gateway website, and I'm just going to highlight a couple of these while we're here. So if you click on surveys at a glance, you can see here, if we click on core interview, we have the KLOSA metadata for the core interviews of KLOSA, waves 1 through 6 here. You can also switch over to end of life, and you'll see the KLOSA end of life surveys and the health assessment that we mentioned. That's part of KLOSA, that grip strength assessment. There's also a life history assessment at between waves 1 and wave 2, that job history assessment. Inside of each one of these metadata, we could go into one of those. So let's go into KLOSA wave 3. We'll see that most modules or most surveys are divided into modules with different topics. We could go into the health status module, the C1 module. You can see we show you a flowchart version of that survey. So we can see that this question, based on how you answer this, you're asked this question, and then you get answered this question. Understanding that survey skip pattern is quite helpful. You can also look at the module items individually and go into any one of those and find more information. or you could look at it in kind of like a traditional codebook view. So we kind of had printed out both the question text, the answers, and how those answers are coded. So that can be quite helpful. We also have a search built in. So one of the things you could do is instead of going through the survey itself, you could just search for instance, smoking. And we could say we just want to search KLOSA. You could also say all studies. We're going to just search KLOSA here, and we're going to limit it to all years. And what you can see here is that we find survey questions in 2006, 2008, 2014 that are all related to smoking. So we see some of those smoking questions we looked at before. We also see some questions that we didn't look at. So when did you first start smoking? How many cigarettes or smokes do you smoke in one day now? When did you smoke the most in your life when you smoked? So the search is quite helpful to be able to quickly kind of find results if you don't want to browse through the study itself. I'll also mention we have some concordance tables. So again, if we stick with health here and health behavior, we could look at concordance table. And what this is going to highlight is differences between different studies or waves of a single study. So you can see here we have smoking questions inside of all of our studies that we do. And so for KLOSA, we mentioned that the smoking frequency is asked, ever asked, ever smokes is asked, smokes now is asked. You can also see this for drinking. And we have a whole host of these different concordance tables that you can look at. So you can see this comparability across different studies. The last thing I'll mention is that we do have a study overview, which has a lot of the same information that's in this webinar, but in a slightly different format. So this is the KLOSA study overview. So it includes some of that information about the sampling frame, the data collection, whether there's any data linkages and harmonized data sets, how you get access to the data. So that can also be a helpful resource. The harmonized data sets, which have already been created, which are comparable to the harmonized data files, include this following list. I won't read them all, but maybe I'll just say what countries or regions they cover. So we have the RAND HRS and harmonized HRS that covers the United States. I'll mention briefly that the harmonized HRS is a supplement to the RAND HRS. So the RAND HRS is the main harmonized file, and then some additional variables, especially for cross-study comparability, are contained in the harmonized HRS. We have the MHAS, which is Mexico, England, Europe and Israel, Costa Rica, Japan, Ireland, China, and Malaysia, which we just recently also released. That includes one wave. And the harmonized KLOSA EOL has also some comparable data files. That includes, for the United States, the harmonized HRS end of life, for Europe and Israel, the harmonized share end of life. And we have a version of the harmonized ELSA end of life that's coming soon, as well as the harmonized MHAS end of life that's also coming soon. So those cover England and Mexico. For all of the harmonized data, you can go to the downloads page of the Gateway, and you can get links to download the survey data and to download the harmonized data sets. You can also download the harmonized codebooks or download the data creation code needed to create the data set if it's not downloadable, which is only in the case of share and KLOSA. On the downloads page, you can also register to access quite a few of the HRS family of studies, if you see in that blue box there, and that includes KLOSA. So if you wanted to register with KLOSA at the same time that you register with some other studies, you could use that data access, that kind of universal data access that we've built in there. And that wraps it up for me. So I'm going to stop sharing, and my colleague Jenny Wilkins is going to take over. But I'll still be available at the end to answer any questions.
So hi, everybody. As Tristan said, my name is Jenny Wilkins. So we're going to go ahead and get started on the analysis portion of this webinar. The code that we'll be using for this analysis, as well as the slides and a video from today's webinar, will be made available on the Gateway to Global Aging Data website after the webinar. So we'll be going through 3 brief analyses today. Our first two will be a cross-sectional and longitudinal analysis that features the Harmonized KLOSA. The third will be a longitudinal analysis that also incorporates the Harmonized KLOSA end of life. Generally speaking, we'll be following the same steps more or less for each of our analyses today. First, we're going to create the Harmonized KLOSA dataset. Second, we're going to identify the relevant variables we need. Then we're going to load the Harmonized KLOSA data into an analysis dataset and make adjustments to that data if necessary. Then we're going to apply weights and move ahead with our analysis. So the first thing we're going to need to do is create the Harmonized KLOSA dataset. To do this, we would need to visit the KEIS website, and there's a link provided in the top row of the downloads page on the Gateway website. Once you've logged in, you will need to download the core interview Stata data from the 1st through 7th wave of KLOSA and the imputation data from the 1st through 7th wave of KLOSA. As you can see, each one of these are available as a single package download. Then you'll need to download the individual exit Stata files for waves 2 through 7. From the Gateway to Global Aging Data, you'll download the Harmonized KLOSA Stata creation code. In the Stata creation code, you'll need to edit the folder locations of the original KLOSA data and where you want the Harmonized KLOSA dataset to be saved. Here you can see the lines of code that you'll need to adjust within the circle. You'll want to remove the double bars at the beginning and end of the quotes. These are just an indicator for you to replace the information. Then you can go ahead and run the Harmonized KLOSA creation code in Stata. So this can take up to a couple of hours depending on the speed of your computer. Then you'll want to download the Harmonized KLOSA codebook from the Gateway to Global Aging Data downloads page. As my colleague Tristan already went through, there are several ways to identify relevant measures in KLOSA or any other HRS sister study, including several tools we provide on the Gateway website, as well as the Harmonized Codebooks. For the sake of time today, we'll just move on to our first analysis. So this will be a cross-sectional analysis using the Harmonized KLOSA. Our research question will ask if there are differences in self-rated health across education levels and genders. KLOSA, along with many other HRS sister studies, asks the respondent to rate their health, usually using a scale from excellent to poor. We'll be looking at the mean level of self-rated health and then looking at the mean level of self-rated health across education levels and gender, and we'll perform an adjusted walled test to compare those means. So we'll need to identify our selected variables from the Harmonized KLOSA, and you can do this using the resources available from the Gateway website at g2aging.org. While we've already learned that KLOSA is a longitudinal study, we'll first be just doing a cross-sectional analysis and looking at a single wave. So in this case, wave 7, which took place in 2018. In KLOSA, the respondent ID is called PID, and self-rated health for this wave is called R7SHLT. We'll also pull in the respondent's gender, called RA gender, and their harmonized education level, which is a simplified version of the ISCED categories called RAED-UCL. We also have an indicator of wave participation called INW7, and we have our individual cross-sectional analysis weight called R7 weight resp. So we're going to start using Stata now. So I'm going to open up our program in the Do File Editor inside of Stata, which again will be provided on the website after the webinar. If you're unfamiliar with Stata, I'd encourage you to follow along. A lot of the commands will be similar if you're using a different statistical package like SAS, SPSS, or R. We do offer some examples of an analysis in SAS which would be found on the documentation page of our website. So I'm going to go ahead and open this program called Intro KLOSA Webinar April 2021. I'm going to just zoom in a little bit here. So if you want to run this program at home, you'll need to edit lines 5 and 6 to say what folders your data is coming from. One other thing you'll notice about this program is a command called pause. So once we start to run the program, the pause command will stop it at different points so we can look at the output that Stata has given us, and then we'll move on. So we can execute or run this do file by clicking on this icon with the arrow in the top right. So Stata has run our do file to the first pause, and when we're ready to continue, all we need to do is type Q and enter, and the program will continue running. So I'll bring up the commands on the slides where it's a little easier to see, and then we'll jump back into Stata to look at the output. So the first thing we want to do is read in the observations and variables from the Harmonized KLOSA. We employ the command use because we're going to use this dataset and bring it into Stata. Stata works by building a dataset in its memory, which makes it fast, but it needs to be brought into Stata memory first. So we're going to use the variables we identified using the Harmonized KLOSA dataset. So if we jump back into Stata, you can see that we brought in variables from the Harmonized KLOSA and have done a quick tabulation for INW7. We have just over 11,000 respondents from the entire Harmonized KLOSA, and we have just under 7,000 respondents who participated in Wave 7. So now we're going to actually examine our main variable of interest, R7SHLT, which is our indicator of self-rated health. We're going to perform a tabulation or tab to look at the frequency of each rating. So let's switch back to Stata and take a look. So all we need to do is type Q and enter, and the program will continue. And you can see that we have ratings from 1 to excellent to 5 for poor. We can see that there aren't very many respondents who selected excellent or very good, but most have rated their health as good, fair, or poor. So now we're going to apply weights, and one of the helpful things about using Stata is that they have a lot of built-in commands for using survey data. One of those commands is called SVY_set, which tells Stata how this complex survey is set up. This allows us to tell Stata how the data is weighted. Here we're using the person-level cross-sectional weight, and we can end up with national-level estimates for people over the age of 45 in South Korea. Once we enter this SVY_set command, we don't have to specify these things for every single analysis command that we make from here. Instead, Stata will recall this information. So if we do this inside of Stata, you can see we use this command called SVY_describe, so we can describe our sample. You can see that we have one strata here representing South Korea with just under 7,000 respondents who participated in Wave 7. So I think we should first estimate the mean for self-rated health for the population covered in the KLOSA sample. So that is people age 45 and over in South Korea. So to recall the SVY_set information that we gave Stata about our survey design and how we want our estimates weighted, we're going to say SVY, which tells Stata to recall what it was already told, then ask for the mean of R7SHLT. Then we can put over RAEDUCL, RA gender after the mean statement. By including two variables in the over statement, we are essentially performing a cross tabulation where we can see the mean of self-rated health over every combination of education and gender groups in a single statement. So let's see what this looks like. So when we do this in Stata, we get a mean of 3.6. So on average, a person who is 45 or older in South Korea will rate their health somewhere between good and fair. And if we look at the mean by gender and education level, you'll see that Stata tells us who is in each subpopulation. And we can see the mean self-rated health for our 6 gender and education level categories. You can also see that we have standard errors and 95% confidence intervals, which can be helpful if you want to know whether these are meaningful differences. So if we look at these levels of self-rated health and by gender and education visually, we can see that the least educated in South Korea have higher scores, meaning they report worse health than more educated individuals. We also don't see a clear trend happening between genders. Sometimes women have higher scores than men, especially in the least educated, and sometimes women have lower scores than men, like among those with tertiary education. And if we want to test whether the differences we see are significant, then we can use a command called test, which is a post-estimation command, meaning you run it after you've created your estimates. So here we've created mean estimates of self-rated health by education level and gender. So we'll test whether there's a difference between men and women within a single education level, and whether there's a difference between education levels for a single gender. So if we run this and test for a difference between subpopulation 5, which is men with tertiary education, and subpopulation 6, which is women with tertiary education, Stata will perform an adjusted walled test. We'll see that the probability greater than the F statistic is 0.0341, which is statistically significant at an alpha level of 0.05, but not significant if our alpha level is 0.01. When we run this with subpopulations 1 and 5, looking at men with the least and most education respectively, we get a probability greater than the F statistic of 0.0000, which is statistically significant. So now we're going to start our longitudinal analysis using the Harmonized KLOSA. We're going to find out what factors are related to a decline in self-rated health over time. To do that, we're going to be looking at 2006 and 2018, which happen to be waves 1 and 7 of KLOSA. As we went over before, we're going to be using the respondent ID and self-rated health, but this time we'll be adding self-rated health from wave 1. And we'll be using gender and harmonized education levels again. We'll also be adding the respondent's age in wave 7, called R7 age Y, and an indicator of living in an urban or rural location called R7 rural. We'll also be using a person-level longitudinal weight called R7L weight resp. So I've already brought in all the variables we needed for this analysis, so we can go ahead and start calculating a change in self-rated health from wave 1 to wave 7. To do that, we're going to generate a new variable called R7SHLTC with the C meaning change. We're going to take the respondent's self-rated health from wave 1 and subtract their self-rated health from wave 7 if they have a value ranging from 1 to 5 for each of those variables. We're calculating it this way so that negative values will imply a decline in self-rated health, and positive values will imply an improvement in self-rated health. For example, if the respondent reported excellent health in wave 1, which would be a score of 1, and reported poor health in wave 7, which would be a score of 5, then R7SHLTC would have a value of -4. Calculating a variable this way also creates a balanced sample of individuals who participated in wave 1 and wave 7. This sample would not include any of the new sample added in wave 5, anyone who passed away or was lost to follow-up between wave 1 and wave 7, or anyone who participated in both waves but had a missing value for self-rated health in one or both of these waves. So let's switch back to Stata and look at this variable. So when we continue our program, we'll find a tabulation for R7SHLTC, this variable that we just created. We can see that we have values ranging from -4 to +4, but most of the values are grouped around -1, 0, and +1. So now we're going to create an indicator of a decline in self-rated health. To do that, we're going to use a command called recode to adjust the values from R7SHLTC. So values of 0 through 4 of R7 SHLTC, meaning no change or an improvement in self-rated health, we're going to assign a value of 0. For values of -4 through -1, meaning a decline in self-rated health, we're going to assign a value of 1. Then we're going to generate a new variable for these assignments called R7 SHLTD, with a D indicating a decline. So let's switch back to Stata and take a look at this variable. So we can see that about 2,500 out of 6,100 respondents had a decline in self-rated health from 2006 to 2018. Now we're going to apply our longitudinal weights. We're going to use the svy-set command once again, but this time using R7L weight resp, which is the longitudinal weight for respondents from wave 1 to wave 7. Since we're analyzing a decline in self-rated health, which is a categorical variable, we can use the proportion command. We're going to still say SVY to recall the weighting information we provided to Stata, and then say proportion R7 SHLTD. So let's take a look. As we continue our program, we can see that approximately 42% of South Koreans who were age 45 and older in wave 1 will have experienced a decline in self-rated health from 2006 to 2018. And if we want to estimate the effect of different factors on a decline in self-rated health between these waves, then we're going to run a regression. Since we're looking at a binary variable, we're going to run a logistic regression. In this case, I'm using the logistic command, which will produce odds ratios, but you could also use the logit command, which will produce coefficients. So we're going to use SVY again and state logistic, and then we're going to list our dependent variable, R7SHLTD, and then add our independent variables for gender, education, age, and urban or rural living. We have an I dot in front of our gender and education variables because these are categorical with multiple categories. So the I dot will create dummy variables for each category using the first one as the reference category. So when we run this in Stata, we see our results. Very briefly, in case you're not familiar, an odds ratio of 1 implies that there is no effect, while an odds ratio greater than 1 indicates greater odds, and an odds ratio less than 1 indicates worse odds. As we look at our results, it appears that women have lower odds for a decline in self-rated health, while those with higher education have increasingly higher odds for a decline in self-rated health. And these are statistically significant based on the p-values of 0. But when we get to age and urbanicity, our odds ratios are much closer to 1, and our p-values aren't significant. So now we're going to move on to our longitudinal analysis featuring the Harmonized KLOSA and Harmonized KLOSA end of life. And our research question will ask which health conditions are more likely to require an ICU stay before death. So we're going to go through the same steps as before, but this time creating the Harmonized KLOSA end-of-life dataset. You need the same data from KEIS that was required to create the core Harmonized KLOSA, and you'll need to have already created the core Harmonized KLOSA. You can download the separate Harmonized KLOSA end-of-life data creation code from the gateway, edit the folder locations, and run the code. And you'll want to download the Harmonized KLOSA end-of-life codebook from the gateway website as well. Once the Harmonized KLOSA EOL is created, we're going to identify the variables we want to use, merge in those variables with our analysis data, and move ahead with our analysis. So now that we're looking at the end-of-life data, we could be taking data from any exit interview from wave 2 to wave 7, or 2008 to 2018. And this is longitudinal because some of the variables we use will be taking information from the respondent's last core wave before they passed away. This means that we're not analyzing the same time period for everyone because some individuals passed away earlier and some passed away later, and some had an exit interview happen shortly after death and others had an exit interview years later. But once again, we'll be using the respondent ID called PID, making the end-of-life data easily mergeable with the core data. We're going to look at whether the respondent had an ICU stay prior to death, called RAX HSP ICU. We're also going to include the respondent's age at death, called RAD age, an indicator of their last core interview wave, called RALST core, an indicator of which wave their exit interview took place in, called RAXT, and an indicator of whether they had an exit interview at all, called INXT. Since we're merging with the core data, and there are many KLOSA respondents who are still alive, INXT is helpful for easily distinguishing those who have had an exit interview and so are included in the Harmonized KLOSA EOL, and those who have not. Finally, we'll be looking at some health indicators. We'll have variables indicating whether the respondent had any difficulty with any of 7 activities of daily living, and whether they had difficulty with any of 10 instrumental activities of daily living in the last 3 months of their life. And we'll also include variables indicating whether the respondent ever had a doctor-diagnosed health condition, which combines reports from the core interviews and from the exit interview. So now we're going to expand our existing analysis dataset with the variables we identified from the Harmonized KLOSA end of life. Since we expect there to be individuals in common between the Harmonized KLOSA and Harmonized KLOSA end of life, we're going to merge on a one-to-one basis using the respondent identifier PID using the Harmonized KLOSA end of life dataset. Then we're going to specify that we want to keep using the variables we identified on the previous slide. So we'll go back to Stata now. And when we continue running our code, we can see that there were nearly 9,000 respondents from our original dataset who didn't match, and we match about 2,200 respondents with the Harmonized KLOSA end of life. Before we go further, I think it would be helpful to cross-tabulate exit interview wave by the last core interview to get a better idea of how far apart the last core interview and exit interview can be. When we continue, we can see this cross-tabulation. It is most common for the respondent's exit interview wave to occur the wave following their last core interview. For example, 187 respondents had their last core interview in wave 1 and their exit interview in wave 2. And the same pattern can be seen going diagonally across the table. But it's important to note that exit interviews can occur in any wave after their last core interview. Sometimes it's difficult to get into contact with someone who is willing and able to complete the exit interview, or the respondent could live through several waves but be lost to follow-up and only tracked down once they are deceased. In these cases, the exit interview will occur several waves after their last core interview. So, for example, there are 110 respondents who completed wave 1 but no other wave until an exit interview was completed on their behalf in wave 7. And now we can look at how many people were in the ICU during a hospitalization prior to their death. To do that, we're going to tabulate RAX HSP ICU. And in this case, we want to be able to see what missing values there are. So we're going to add if INXT is equal to 1, meaning we're limiting the results to those who have had a completed exit interview, and the comma M will display any missing values. When we run this, we see that about 700 respondents had an ICU stay at the hospital prior to their death. We also see that almost 870 respondents had no hospital stay at all and have a special missing code applied. So we'll need to keep this in mind as we continue. So we're going to create a variable indicating self-rated health from the last core interview to see if that has any impact on being in the ICU. To do that, we're first going to generate a new variable called RAX SHLT and set it equal to blank missing. Since the respondent's last core interview could have taken place in any wave from wave 1 to wave 6, we're going to employ a for values loop from wave 1 to wave 6 and replace our new variable RAX SHLT with the core RW SHLT for the last core interview wave. So we'll switch back to Stata and take a look. So we've run through our for values loop and now run a tabulation of RAX SHLT. We can see that we have about 2,200 responses for the respondents in the exit interview, and that most are rated as poor. Now we're going to actually estimate the effect that these demographics and health conditions have on any ICU stays prior to death for those who have been hospitalized. You'll notice that we did not apply weights, and this is because no weights have been created or provided by KLOSA for analyzing this exit interview data. So we're just going to run our regression unweighted. We're going to use the logistic command once again, but this time our dependent variable is RAX HSP ICU, and we have a long list of independent variables. So let's check out our results. When we look at our results, we can see that with an odds ratio of 0.98, age very slightly decreases the odds of staying in an ICU for those who are hospitalized. It looks like the p-values for gender and our self-rated health categories are not statistically significant contributors here. However, when we get to difficulties with ADLs, the odds ratio is 2.7, meaning those with any difficulty with ADLs have much higher odds of staying in the ICU if they are hospitalized. It also looks like ever having cancer and ever having a heart problem also increases the odds of having an ICU stay, but to a lesser extent, while any difficulty with IADLs, lung disease, stroke, diabetes, high blood pressure, and memory disease are not significant contributors to entering the ICU if they are hospitalized. So that's the end of our analysis and our webinar. Today we did cross-sectional and longitudinal analyses, but we could easily do cross-country analyses using the Harmonized KLOSA or Harmonized KLOSA End of Life in conjunction with our other core harmonized datasets or harmonized end of life datasets. If you have any questions or comments, visit us at g2aging.org or email our help desk at help@g2aging.org. I'll also mention that the slides, a video recording, and the Stata code from today's webinar will be available on the Gateway to Global Aging website in the next few days. This webinar and many past webinars can be found on the Documentations page under Recent Presentations. We will also be releasing a blog about the Harmonized KLOSA End of Life tomorrow, which will be available on the News and Blogs tab of our website. So thank you for joining today's webinar, and we hope you find the harmonized datasets useful. After the webinar, you'll be sent a short survey where you can provide feedback or tell us about what topics you'd like to see in future webinars. We want our webinars to be relevant to you, so please fill out the survey. We're now available to take any questions that you might have, which you can do in the Q&A or chat features, and we'll be here for as long as there are questions. But if you're leaving us now, thank you again for attending and have a wonderful day.
Thanks, Jenny. So we do have a few questions, and some have already been answered. I'll just briefly go over those, and then we can answer some new ones. So a few people had questions about, are the slides going to be available? So yes, so the slides, recording of this webinar, and the Stata code that Jenny used are going to be available on our documentation tab, as Jenny's listed here on this current slide. There's another question about, does the process of downloading KLOSA apply to other harmonized data sets? No, so for most data sets, you can just download the harmonized data set itself. You don't have to run the Stata creation code, with the exception of KLOSA and share. But for each study, you do go to a different website. So for instance, the HRS has a website that distributes all of their data, including the RAND HRS and the harmonized HRS. The Charles, the Chinese study, has a website which distributes the Charles data and the harmonized Charles data. There was another question about, do we use population and strata weights for analysis? Why only use a respondent weight? So KLOSA only provides two sets of weights, really. So one is called what they call a cross-sectional weight, and one is a longitudinal weight. The main difference between those is that the longitudinal weight also accounts for the probability of leaving the sample, so sample attrition. But the cross-sectional weight inside of KLOSA accounts for the inverse number of selection rates, the inverse number of response rates, and benchmark weighting. So inside of that one weight, it is supposed to be adjusting both for the probability that someone is included inside of the sample and responds to the sample, and that they're population representative, which is why we just use that one weight here. Ginny, there's a question for you in the chat. So into that says, are you concerned about the quality when there is a big gap between the last interview and the end of life interview? For instance, the last interview was done at wave 1 and the end of life interview was done at wave 7.
Yeah, so that is definitely something you want to consider in your analysis. For that very reason, we actually create a variable that indicates how long the death was, or like how long of a time was between the respondent's death and the exit interview. So it's something you want to consider. There can obviously be lapses in memory that occur over time. And so the answers that you receive might not be as accurate as if the exit interview occurred much more quickly after the respondent's death. But, you know, there are also other cases where people have extremely good memories, and this is obviously a significant event in their lives when someone close to them passed away, and so they could remember pretty much everything very accurately. But it would definitely be something you'd want to consider.
Thanks, Ginny. And then we had one other question about the weights, but I'm assuming that I did cover that already. And they have two kinds of weights that they release, and that is different than some other studies where they do release a sampling weight and then also an analysis weight, for instance. And so I think that we've answered the questions that we've got so far. If there's any other questions, I think Ginny and I are happy to continue to answer them. And you can also raise your hand if you like and just ask the question using your voice. That's certainly an option. Well, I think that might wrap it up, and we're right at the hour. So yeah, thank you everyone for joining. Yeah, thank you for Ginny for going through those great examples of doing analysis using the harmonized KLOSA data sets. If you have any further questions, again, you can always email us at help@g2aging.org. And we hope this was a helpful webinar today. Made you interested in using KLOSA and some of the resources that the Gateway offers around KLOSA. Thank you.